Ozempic side effects. If you've been scrolling social media or watching the news recently, you've heard this phrase a lot. But most of what's trending isn't actually the full truth. There's hype, fear, misinformation, and very little clear explanation about what's real and what's exaggerated. I'm Michele Ariana, lead empowerment coach at Fast 40. And after working with thousands of women over 40 who've been trying everything from diets to workouts to quick fixes, one thing is clear. You deserve to understand the honest science and what it means for your health. In just a moment, Dr. Cody Golman will break down the single biggest insight most people never hear about these medications. But first, let's get grounded in the facts that actually matter. Let's start with what Ozempic actually is. Ozempic is a prescription medication approved by the FDA for people with type 2 diabetes to help control blood sugar. The active ingredient is semaglutide, a glucagon-like peptide 1 receptor agonist that works by reducing appetite and slowing gastric emptying. The same molecule is marketed in a higher dose under another brand name, Wegovy, which is FDA approved for chronic weight management in people with obesity or weight-related health conditions. The important point here is that neither medication was originally created as a standalone weight loss drug, and many of the side effects that we'll discuss stem directly from the way these medications alter digestion and appetite signals. Now, here's where the story gets confusing for most people. On social media, you'll see people saying things like, Ozempic lets you eat anything without gaining weight, or the side effects are just nausea, you can ignore it, or worse. Nothing really goes wrong. None of that tells the full story. Semaglutide slows how fast your stomach empties into your small intestines, which helps reduce appetite, but also changes how your body processes food. This slowing of gastric emptying is a known side effect that the FDA specifically added to the prescribing label because it directly tied to many of the most common side effects patients were experiencing. And that was quoted in Pharmacy Times. Let's get specific. According to the FDA prescribing information, the most commonly reported side effects of Ozempic include nausea, vomiting, diarrhea, abdominal, stomach pain, and constipation. These are digestive symptoms that occur because food moves more slowly through your digestive tract when semaglutide is present. These same reactions are also listed in Wegovy's prescribing information, and they can range from mild to, in some cases, severe, according to U.S. Food and Drug Administration. It's critical to understand these aren't random flukes. They are expected physiological effects of how the drug works. But here's where nuance matters. Some people get these symptoms mildly and adapt, and others have reactions that land them in urgent care or the emergency room. In fact, a large analysis of hospital data found that gastrointestinal symptoms such as nausea, vomiting, abdominal pain, and diarrhea were among the top reasons people on semaglutide medicines went to the emergency department, with approximately 4 ER visits and fewer than 1 hospitalization per 1,000 users, according to Health. There have also been regulatory updates adding rare but serious side effects to the labels, like delayed gastric emptying, which in extreme cases can lead to conditions like intestinal blockages, ileus or gastroparesis, where the stomach and bowels stop moving normally. Regulatory agencies in the US and Australia have recognized these as possible adverse events and update product information accordingly. The Gut Republic says this. You might also see stories about other serious issues such as pancreatitis, gallbladder problems, dehydration leading to kidney stress, vision changes, or even rare thyroid tumors in animal studies. These severe side effects are documented in safety analysis and patient information guides, and the FDA includes warnings about them because they can occur in some users. It's true that the significance of a thyroid C-cell tumor risk in humans is still uncertain, but medications like Ozempic and Wegovy carry warnings about it because semaglutide causes thyroid tumors in rodent research, and safety labeling reflects that, according to Garrett Law Group. Now, let's talk about how the drug feels in everyday life, because the clinical labels don't always capture the emotional experience. Many women that I've talked to told me they tried these medications hoping for relief from constant hunger and frustration around food. Instead, some felt disconnected from pleasure around meals, or they felt like their body was rejecting the experience of food rather than partnering with it. One woman in our community felt nauseated so often she began feeling anxious around dinner time herself. And the relief she experienced and expected turned into worry before every meal. These are emotional realities that matter just as much as the clinical data. Here's a small micro win that you can use today, whether you choose medication or not. Slow down during a meal and ask yourself, am I eating because I'm hungry, or am I eating to soothe stress or emotions? That one habit increases awareness and helps your nervous system learn real, satiety cues, decreasing the likelihood that digestion struggles feel like your fault. It's a tiny shift that rewires how your brain communicates hunger to your body. Now, I want to hand things over to Dr. Cody Golman, because what he's about to share is the biggest thing most people never hear about Ozempic side effects, and what actually drives long-term sustainable change.
Thank you, Michelle. This is Dr. Cody Golman. I want to take you deeper into how these side effects tie into the biology of weight and metabolism, because understanding this is what separates confusion from clarity. So first, it's important to remember that medications like Ozempic, Wegovy, trizepatides, right, it can be useful tools for certain people, but particularly those with type 2 diabetes or specific metabolic conditions. But they're not magic bullets. They interact with your hormones and digestive signaling, and that's why the side effects we just discussed show up in the first place, right? Another layer that rarely gets explained is what happens after you stop the medication. Research in real-world experience and data shows that significant proportions of people regain much of the weight they lost once the appetite suppression from the semaglutide wears off. Recent analysis indicate that without building new sustainable metabolic habits during use, weight often returns within months after stopping, sometimes as quickly or faster than it was lost. That means that the drug was managing symptoms, not rewiring underlying hunger or energy regulation. Here's another nuanced piece that most people don't hear from the flashy videos. Because semaglutide slows gastric emptying, it can also delay how other medications are absorbed, which matters if you're taking other drugs. The FDA labeled specifically warns about delayed gastric emptying, which can have an implication for anesthesia and other medical procedures if your stomach doesn't empty as expected. Let's also address the risk versus benefit conversation, honestly. These medications are tools, not cures. They may make appetite less intense, but they don't automatically fix metabolic inflexibility, stress, sleep disruption, or chronic inflammation, all of which influence long-term weight regulation health. And now a broader approach that includes nutrition, muscle preservation, and strength through support and stress management, and by the way, also sleep consistency, one that induces safety and helps you let go of the fat, right? That's the one that really creates stability. That's how lasting change happens, right? I want you to leave this with compassion for yourself and your body. Now, if you're thinking about Ozempic's, side effects, and whether this is a path that's right for you, talk to your doctor, who will discuss not just the weight change, but digestive health and the potential adverse events, the general metabolic health, and how to protect lean muscle, hydration, and nutrient status. This conversation matters more than any trend on social media. So if you're not already part of our Fit Over 40 community, we encourage you to join us. If you are, drop a comment. Let us know what you think about this video and what you took away. And of course, if you need personalized help and support, book a one-on-one call. We are here and prepared to walk through this with you. Again, your body is not the enemy. It's waiting for you to speak its language. And its language is stability, consistency, trust, and love. Not fear, not shortcuts. So let us help you together. All right, we'll see you in another training.